Okay, so now I don't know if I've ever done a video on, go ahead, relax your head down. If I've ever done a video on flexion distraction technique for the neck. This might be a first. So this is similar to the lower back, but this would be for pinched nerves in the neck or in the brachial plexus region. So this is a little different, just relax yourself. My table's a little squeaky, so excuse me, folks. Is one finger or hand worse than the other as far as numbness and tingling goes?
No, they all say this three is worse than this two.
Okay, so the outside three, the pinky finger and ring finger and middle finger?
This one is a pain and those are tingling.
Okay, so she gets tingling in digits 3, 4, and 5. The outside fingers, pain into the thumb. Okay. And we're going to go ahead and affect all those nerves. So that's the lower part of the cervical spine, okay? And then after we do this, we're going to do a little bit of traction. I did some traction with the lower back. I find it more effective on the lower back of the neck. I'm doing a little bit of traction here, but we may add a little bit of Y-strap traction afterwards just to help her more. Get her more comfortable over the weekend. Get rid of that numbness and tingling and pain into the thumb region, okay? So the thumb pain in there, that tells me C6 nerve is being pinched or compressed because that controls the thumb, sensation in the thumb. And C7 and C8 or T1 control the sensation in the middle finger and the outer fingers, the pinky fingers. So it's a very gentle motion, but very effective, and you feel that right there. So we're on treatment 5 today with her. Go ahead and turn over on your back. And she's had so far 30% improvement in the tingling and numbness and pain in the fingers. So in week 2. So typically with Cox Flexion Distraction Technique, we want to see about 50% minimum improvement in 4 weeks. So we're at week 2 now, and we're pretty much on track. 30%, we're a little bit ahead. So over the next week or 2, we're going to be looking for that other jump, another 20 or more % jump as far as improvement in her symptoms down into her hands and fingers. Now remember, anytime you have numbness or tingling in the hands or fingers, it's a neurological condition, whether it's carpal tunnel syndrome or whether it's coming from the neck. We treat both. If it's carpal tunnel syndrome, we may adjust the wrists, open up the carpal tunnel region, and then do cold laser therapy. Relax here. To reduce all the inflammation, and cold laser works really well and quickly for carpal tunnel syndrome. So don't get the surgery. Get laser done first, non-invasive, and have it checked and adjusted. Only CCEP extremity chiropractors adjust the wrists. I do that. Not all chiropractors do that. Okay, so just be aware of that. But cold laser therapy without the adjustment can be very, very effective. Now, I'm going to do a little bit of traction on her neck. It's called a Y-strap, and you see the ring dinger all over, lift your head, all over YouTube and the internet. We are not doing the ring dinger. That's not appropriate way to do this, and we just don't do that. We do evidence-based chiropractic here, not ring dingers, okay? Anyway, so we're going to gently pull, and what we're doing is decompressing the discs, opening up the space, not only the disc space, but also the space in the foramina where the nerve exits the spine and goes down and runs down into her hands and fingers. So we can get rid of that numbness and tingling in the hands and fingers, okay? Now, we know it's coming from her neck, but if someone did have carpal tunnel syndrome, you can have both. You can have disc herniations or disc bulges in your neck, pinching the nerves, causing numbness and tingling in the hands or fingers, and then also carpal tunnel syndrome or trigger finger, something like that. We treat all of the above in different ways, of course. So we do some nice light traction and gently drop your head back, and that's it. Laser therapy can also be done for the neck region to inhibit and downregulate the nerves. And this is the best non-invasive approach to neurological conditions or cervical neurological, cervical pinched nerves, cervical disc herniations, stenosis, and that of the like. So thanks for tuning in. If you have any questions or comments, comment below. Appreciate you. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.